75 per day. In parallel with that, we're developing tests to go on our high throughput, high capacity analyzers, which are much more automated, and once those are up and running, we can do several hundred to a few thousand a day. So we're used to doing very high throughput, very rapid testing with a rapid turnaround time. We get about 20,000 tubes of blood every day into this lab, and those results go out by the next day, usually within a few hours.
And time is of the essence here, because time is of the essence in these tests, because the longer someone waits for a test result, the more they're going to expose themselves to other people. So the timing is very important, and having a lab like this is very important, and having the resources so they don't have to, so they can move as quickly as Dr. Breening talked about is very important.
How long does it take from start to finish to do a complete testing on a person?
It takes a few hours. The manual test takes 3 or 4 hours to get done. Once we get it on the automated analyzers, we anticipate we can do this in about 2 hours once it gets put on the machine. So once the sample gets delivered here, we can get a result out in a couple of hours. And as mentioned, we think that'll be very helpful for managing.
So if you get tested in the morning, you'll know by the, if you get tested in the morning, you'll know by the evening whether you have it or not.
Is this procedure mobile? Can it be mobile at some point?
Semi-mobile. We currently do molecular testing for respiratory viral pathogens such as the flu in almost all of our hospitals. Those are on, again, machine automated platforms. We're currently working with the manufacturers of those machines, and we anticipate probably in the next month or two that we'll be able to move it over to that platform as well. So then we'll have the ability to do local testing wherever the patient is. It'll be in the local hospital laboratories.
And they have hospitals. This is not their only. They have hospitals, as Michael mentioned. How many different facilities do you have?
Hospitals, 23 hospitals.
23 hospitals throughout the New York metropolitan area.
And how confident are you in the availability and reliability of the test kits for this virus from the CDC?
We think it's pretty good based on our experience with other DNA nucleic acid-based tests that we do. These tests have an accuracy that's in the high 90% range, which is as good as just about any other test that we do. Obviously, with a novel virus that no one's ever seen before, we need the epidemiologic data to accumulate on that to get a true answer. But based on the performance of the other tests we do, we test for about 25 other viruses. Those are in the high 90s, like 98, 99% range in accuracy.
So
Okay,
there are other hospitals that actually send their samples here to be tested?
Correct. We have partnerships with a number of hospitals. The biggest group is the New York City Health and Hospitals Corporation. They send some of their testing through here, and there's some other hospitals that we do individual business with that they send their testing here that they don't do in their own hospital lab.
How do you prepare a staff to deal with these issues? Do you guys do training from time to time?
Yeah, we really, for this one, we just had to add on the surge training for the excess capacity. When you're in a lab like this dealing with a lot of infectious samples, we use what are called universal precautions, which is basically every sample that comes through this lab, we treat it as though it could be infected with one of these viruses, because it could be, we don't know. So you'll see in the lab, everyone's gowned up and gloved up, and we take precautions every day that will protect us from this virus.
Let's go see the lab.
Okay, so at this time, excuse me, we're not going to be able to take every camera in at once, but I assure you will get to go back. So if you're getting passed out a gown, you'll be going out now into the first tour.
Derek.
I was the first.
Yes.
Dwayne.